Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast. Welcome to Increda-dental podcast. I'm your host, Alicia Flynn. Today, we're going to speak about helping patients complete treatment in creative ways. We're going to give an example of a real case and show how you can use this in your own office. So let's start with the case. So we had a patient in our practice who had been in a really bad car accident about a decade and a half earlier, and he had ended up having root canals on several teeth and crowns, and things had done very well. But eventually there was just too much trauma and the apicectomies didn't work, and the teeth needed to be extracted and implants needed to be placed. Treatment plan, $25,000. So feeling overwhelmed about this and trying to decide how to digest this, we talked about breaking the treatment out over 2, possibly 3 years. This was in about July. So we started the treatment and the patient was wearing a flipper, but this was the problem. The patient had a severe gag reflex. They couldn't wear the flipper. And at first, this person was an engineer. He's like, you know what? We're engineers. We don't really notice people smile and stuff. So let's try without. He came back about 2 weeks later and said, I can't do this. People are noticing. It's really embarrassing. I think I need to find a faster way to move forward. So we talked about what solutions, what can be available. We talked about financing, and he was like, yeah, that's a possibility. But I've been hearing this thing about work where it's time for enrollment. It's called an HSA account. What do you know about that? Anyway, we dived into it deeper, did some research with him, and learned that this was a great solution for his particular problem. He used the HSA account, got the work done in about 18 months, and had a beautiful smile. It was such a sweet, wonderful case because when he was done, he was almost crying when he got his teeth in because he had his smile back because he still couldn't wear that flipper. So it took some time to get things where we wanted them to be. So what is an HSA or an MSA account, and how can you use these and help your patients in your practice? An HSA is a health savings account, and an MSA is a medical savings account. HSAs are more common than MSAs. And so what it does is this. It allows an employer to set up an account for his employees or her employees where money is taken out of their check before they're taxed. And then they are given like a debit card, and they can use this card to pay for any type of medical bills. A lot of patients do not think about the dentist using their HSA account, but they can use it at the dentist, the chiropractor, for prescriptions. They can use it anywhere where there's a medical bill. So speak to your patients and ask them if their employer offers an HSA or an MSA account. It can save them quite a bit of money because they're not taxed when it's on pre-tax dollars. And it makes it easier for patients to pay their bill because it's already set aside in this account. Now, for 2025, the amount for some accounts is up to $4,300. And depending on how their employer sets it up, it can be up to $8,500. And it just depends on how the company sets up this account. But either one can be used in your dental clinic. And most dentists are millionaires in dental treatment that is planned but not completed. So we want to help our patients move forward with their treatment. We want them to have the treatment done before the decay gets any larger, before they need more treatment like root canals or extractions. We want to help our patients move forward in their treatment, and speaking to your patients about an HSA and an MSA account will help them move forward. Enrollment starts as early as September and usually goes through the end of November. I like to speak to my patients about the HSA and MSA accounts as early as June and July, and then again throughout that whole time period, even wrapping back around till January, because sometimes patients miss that window for enrollment. And I like to speak to them about it so that way they know when it comes available again, they can enroll. It really helps patients to move forward in their treatment, doesn't hit the pocketbook so hard, and it's great to have a case where the patient is so happy that they got their smile back, where they're almost crying. It just is contagious throughout the office. So talk to your patients, find out if they have an HSA and MSA account available to them, and see what you can do to help them to move forward with their treatment. Thanks for joining me.